Good afternoon. Welcome to United Medical weekly events. My name is Kemal Erkan. I'm the chairman of United Medical ACO. I'm here with Sean Donovan. Sean is from our business development. He's part of this this show on a regular basis. And as usual, we have a lot of new updates, and also we have a couple of new topics that we are going to discuss. We are going to have two guest speakers, one internally from our clinical integration, and also we are going to have the director of Brandywine Valley SPCA. Tanner Post is going to be with us. And so we are going to start with our COVID update first. Sean, I'm going to bring that up.
Sure.
All right.
Alrighty, so yeah, as usual, we're going to start with our COVID update here. At the beginning of the slide, we have one of the cartoons for this week. It is involving just what's going on with the entire country and kind of the obstacles we're facing with the COVID, guns, climate change, and the fact that we're trying to deal with multiple issues, which we've been covering in these last sessions here in our live Friday webinars. And we will also be getting to that later today with more updates for you. But in regards to the COVID numbers, we are seeing a slight plateau, but the numbers did go up a little bit higher. The US is having, it's like around 93,000 new cases in that past 2-day average. And on the vaccination standpoint, Delaware as a state is now having over 623,000 people fully vaccinated compared to the nation, which has, let's see here, the USA has a total of 223 million. Obviously, we know it's going to be a larger number. But percentage-wise, comparing those two, the U.S. is at 62.5% fully vaccinated, and Delaware's population is at 64.5% having received their full vaccine dosages. And then also in this section here, we do have an update that the U.S. is now approving nearly 800,000 more doses of the monkeypox vaccine. We know that there are now deaths starting to happen as a result of this in the U.S., so we're going to keep our eyes on that. We know it's been about maybe a month or so. We started reporting on the monkeypox, and it was on our radar, but now we're seeing it as turning deadly. So
they're going to change its name. Did you hear about that?
I know. Yeah, they said maybe
so
offensive.
They're going to find a politically correct name because monkeys are not happy about it.
Yeah. Right.
So, all right, so we can do that.
Yep. And then also just at the end of this section, we do want to mention United Medical and our involvement at the Food Bank of Delaware that happened on Tuesday, the 26th.
So let's actually talk about that, because the way that we participate in those events, not just the way that we are, it's not just financial charity, but it's also we are volunteering. So United Medical employees for each event, I think we do once a quarter. We're part of those, and you did your first one.
Yes.
This Wednesday. How was that?
It was good. This is my first event, as you mentioned. I was actually surprised at the amount of people that were showing up for this. I know it's great that we're able to help the community in need. And actually, United Medical, there was our group there, and there was one or two other people that showed up. So it was actually really good that United Medical was able to get people there to help out, because if not, I'm sure it would have been a headache for the one guy who was driving the truck, having to hand out the packages. And we know that having us there, able to staff the different stations, is able to move a lot more efficiently and get people in and out. And overall, it's just a really good thing that we're having the food bank working alongside with us, helping out the community.
So that the way that we work with Food Bank from the beginning, Susan Anderson, who actually was leading that with Donna Gunkel as well. So we wanted that to be more like a business culture for us, so that our employees can participate. And I know Ethan, Nicole, they do a lot of work because they're almost. I think they're most of the events. For whatever reason, I see them more.
They're involved a lot, yes.
With you had also Terrence this week, right?
Yep. So there was actually 6 of us.
From you?
Yeah, so there were 6 of us. We had Ethan, Nicole, and there was me, Terrence, Neil, and Christina were also there. So we had 6 total. And like I said, it was actually really great that we were able to get there, because there was only maybe 1 or 2 additional volunteers other than the food truck operator. So we're able to help the line efficiently. And it was actually great. The people that were receiving these donations were super thankful, kept saying, have a blessed day. And they were really appreciative of what we were doing.
Have you ever done this?
No, I've never.
So since you are part of our case conferences, and also you have a good understanding of social determinant of health, like were you kind of connect those two together?
No, yeah, there was, you could kind of see the types of people and how appreciative they were of what they were receiving, and you could definitely make the connection that this was making a big difference in their life, because we had boxes of their fresh vegetables, fruit, a couple of staple meat products, as well as there was actually more fruit. They had additional fruit that was being added to it, and then we had some frozen vegetables like green beans and such. But you could just tell this was actually going to make a huge difference in their home life. And as we try to connect this with the SDOH, it does have a big impact. And that's what I was just saying. I can't repeat it, but they're just so appreciative of what we were doing that you could tell it makes an impact on them.
It's a good way to reach out to these individuals, and we are actually extremely happy that we are part of it and we are able to make some impact in others' lives. So I'm going to take our first speaker in. Let's see, that's going to be Tanner. Tanner Pulse is the director of Brandywine Valley SPCA. And all right, Tanner. So I'm going to put Sean back in the waiting room. And so right now we should be good. So Tanner, how are you doing?
Great, Kemal. Thank you so much for having me join you.
Well, thank you for actually being part of this. Many people may not know, we actually we had a video shoot. It wasn't a live event, but I believe it was 3-4 weeks ago. And the idea was it was going to play when I was in Turkey. And well, one of those things when we find out when we come back to the office, the sound quality was not so great. So, and you were nice enough to give us more time, and then we can actually kind of repeat what we did, but this time it's going to be through our live event. So now, Tanner, as I just want to make sure that people who are watching us, they know my involvement with your organization. So I'm on the advisory board of Brandywine Valley SPCA. This was, I believe, last year, May 2021. So you guys reached out to me through Dr. Jonah Gora, who's a big animal lover, and I was actually extremely happy that I was able to participate and then do some good for animals. And but there was certain things that was important for me, and I have some questions. Some of our questions are going to be perhaps repeat questions. I have 2 videos running. One of them is, I hope you are okay with what I did there. So this was from our board meeting. So then people kind of can see what we have done, who we outreach to. So if you can kind of give us a brief introduction of yourself and also the organization, and then I'll start with the questions.
Yeah, absolutely. And again, Kemal, thank you so much for having us. And I think the audio quality was our fault. That specific day, they were testing the fire alarm system because it was an active construction site. So when in Rome, we tried to do as best as we could. But my name is Tanner Pulse, and I'm the organization's Chief Advancement Officer. So it is my job to connect the dots often with the community, funders, and then our strategic mission. Brandywine Valley SPCA services the entire state of Delaware. So from Brandywine to Blades, we are very fortunate to have 3 campuses throughout the state of Delaware, one in Newcastle County, one in Dover, Delaware, and then we've got a shelter and clinic in Georgetown, Delaware as well. But the organization really started as the Chester County SPCA. So we service the state of Delaware as well as several counties in the Commonwealth of Pennsylvania. So we've got a multi-jurisdiction, but really our job is really to advocate and rescue some of our most vulnerable and defenseless lives on the planet, which are our animals. And we do that through rich adoption services and clinical services, and then of course our community outreach.
Well, when we first started working together, actually even before we started working together, for me it was one of the most important things was if this was a no-kill shelter or if it was a regular SPCA. I say regular SPCA because the perception, or what I know, is the SPCA do keep the animals for a certain amount of time and then they are gone after that. And you and I think that was our first talk when I said, well, what happens to the animals after you guys actually start helping them? And we are a no-kill shelter. So that's important from, I think, the way that we are making impact, at least for me, it's important. And I know that this is the philosophy of the organization. So do you have anything to say about why certain organizations may have to choose regular shelters versus no-kill shelter?
Yeah, absolutely. So we are, you're spot on, Kemal. So we're an open admissions, no-kill shelter, which really means that our live release rate has to be above 90%. So for every 100 lives that come into our shelter, the national standard is at least 90% or 90 of those lives leave in a favorable outcome. So connected with a forever family. Last year, we were able to achieve a 95% live release rate. This year, we're trending right on par, and we are, expecting to have another year of 95% live release rate. And it really speaks to the robust services that we're able to offer. Amongst us, our staff, we have veterinarians, we have vet techs, we have a standing animal wellness center, but then we also have a behavior team that work with our shelter animals for those harder to place dogs specifically. So our comprehensive approach to the work, I think, is really what is a major differentiator. But I also have to say that the philosophy here in kind of the mid-Atlantic states plays a major role in this. A lot of our shelter partners down south face an uphill battle. There's a lot of different philosophy in the way in which pet ownership is treated. Often communities in the South see pet ownerships and animals as more of a utility. An animal, they stay outside, they live in the dog house, they're chained up to that dog house. They aren't really well educated on the importance of spay and neuter surgeries and the basic humane education services that we try to promote here amongst Delaware and Pennsylvania. And I think that with that uphill battle, that is a completely different philosophy, layered with a bit of a different set of educational kind of instructions, they see often a much higher kill rate or a lower live release rate. And that's because of overpopulation, overcrowding. We, though, believe that all of the lives that come into our care are unique and special, and we always work towards placing those animals with their forever home.
Sure. So when we met last time for this purpose, actually for the YouTube purpose, so it was going to be the facility tour. So instead of being there, we are not a TV production company, so we are a healthcare company, so we couldn't really just do certain things outside of our office. And it makes it so much easier when it's just Zoom, honestly, because we know that certain things are going to be standard. So, but we were able to use all the images. These images are taken by Ethan from our office, and Wilson was with me that day. We did this really nice facility tour, and this was extremely impressive. So, well, maybe I'm biased because I'm part of it, but I'm not really part of it from the beginning. So this was already there. So by the time I got involved, it was already happening. But I was actually extremely proud of this, that we are able to do this as a nonprofit organization. So now we do help animals, but it's not limited to just certain animals in terms of stray dogs or stray cats. So anyone can actually receive services from Brandywine Valley SPCA. Is that correct?
Yeah, absolutely, Kemal. And I think that's a great point. And I love this video that you have playing here in the background. It's great. We've spent probably an hour and a half together touring the facility. And one thing that really is, one takeaway for your audience is that if you own a pet, our wellness clinic is fully accessible to you. I'm sure that a lot of our pet owners in the audience have their private veterinarian that they've got a great working relationship with. And of course, we're never going to say, ditch them and come to us, but we are a really wonderful option, especially for the broader community. And we see often that the community in which we serve are individuals who might not have the financial means and capacity to pay for those high cost services that often folks experience at a private veterinarian hospital. So we're fully accessible to the public for all wellness and surgery needs, or surgery needs pertaining to spay and neuter, that is. But with this facility, we're broadening that potential for surgeries because this is the first shelter-specific ICU. I'm sure I'm jumping around, Kemal, so I apologize.
No, you're fine. Actually, we're gonna cover everything, so don't worry.
Perfect. But we encourage folks to check our wellness centers out. And then if you're looking to adopt, of course, our shelters are open, and we always have cute dogs, cats, kittens, and puppies for potential review. And honestly, they're just looking for their forever home.
So how large is the facility? I know when we got in there from the lobby, there were a couple different units in terms of like how they are being utilized. So it wasn't difficult because my family has a construction background, so I'm pretty good at visualizing what's happening. But the way that it's designed is so there are different sections, and then just the lobby was kind of, even though it was not completed yet, the feeling in the lobby was kind of welcoming. So in terms of the facility, size of the facility, number of exam rooms, if you can just give us those numbers.
Yeah, of course. So the facility itself is 20,000 square feet. And it's really made up of two very distinct locations. We have a individual and private access entrance for both our shelter operations and our clinic operations. And so essentially, folks can come and not have to weave through a shelter environment to take their own pet to their clinic or the wellness center. The breakdown is really quite simple. It's nearly 50-50 of that 20,000 square feet. But what I will say is that the space on the clinic side actually has allowed us to double our forecasted capacity. So currently in our Newcastle shelter, which is an old Newcastle, and that shelter, we currently lease the facility. It was a warehouse that we've really retrofitted to serve our purposes. That space at any one time, we can see in exam rooms 2 or 3 animals at a time. This new space will double our current capacity, which is going to be really impactful for anyone who needs a veterinarian appointment or perhaps has tried to schedule with us and they're getting 2-3 week time periods to book out. We're going to be able to maximize the efficiency. On the shelter side, we're we're adding kennel space. It's nearly doubling our current kennel space, nearly doubling. So we're really excited all around because this facility, for all intents and purposes, really is doubling our capacity to service Newcastle County.
That's pretty impressive. So now we also, what actually makes this facility unique is we are the first in Delaware with the open ICU. And I know this is a big issue for many people. Now, just recently, I lost my puppy, who was, as you know, he was 13 and a half. When first he was diagnosed, that was in 2017, I believe. We went up somewhere in Upper PA, so I won't name the facility because they are doing their job, so I'm not really mad at them. But for many of us, our dogs are cats, especially if you don't have kids. They become almost like your okay, so I know some people are upset when I say this. I think the way that I treat my puppy is probably 99th percentile of any other people who are treating their kids, and how we take care of them and connection that we have. These are extremely intelligent beings, and they're our best friends. So when something goes wrong with them, where the trouble starts. And when first he was diagnosed, Buddy, in 2017, we are in this facility, and before they start anything, the question that I have to deal with was, well, this is going to be about $4,500. What do you want to do? I'm like, so I didn't understand the question right away, although I did, but I'm like, okay, pretended like I didn't think she was asking that. Like that's really bad question. So I'm like, what are you asking? So I said, if this was a human child, were you going to ask me the same question? And then she was still calm, and she said, look, nothing personal, but many people cannot afford it. This is not about you. This is not about your dog. So because this is expensive and many people are not able to, then that was the point where I'm like, what if I didn't have the money to cover those expenses? What would I do? Like, he lived 5 years after that, and I take care of him really well. And 5 years, it was amazing. So I wouldn't want to change anything that there's not enough money to replace that. But what if I didn't have that, right? So because he went through some operations. Now, ICU is extremely important for Delawareans who are not able to maybe afford certain expenses with their animals. So can you actually elaborate that a little bit, and why this is so important for everyone?
Yeah. So Kemal, you and I think, share the same philosophy on how we treat our pets. I've got 4 crazy dogs at my house, and I treat them like children. And you make the excellent point that often in pet ownership, people are faced with really tough decisions based on financial capacity. And we frankly see it every single day. We will have constituents come in and say, this is my dog. It was hit by a car last night. It has a broken tibia. I went to my veterinarian and they want $3,000. And all of these numbers are made up. They're for illustrative purposes. So if anyone in your audience knows a veterinarian and they say, no, it's 1,100, sorry. But they've got this really tough decision in not having $3,000 to pay for a surgery that is critical to ensuring that their pet lives, or humanely euthanizing that animal. That's a really tough decision. So we recognize this need for high quality, low cost veterinarian service that extends to a higher medical acuity for quite some time. And this new facility, we're really proud of it because it is the first in the state of Delaware, and it's really the first in the region that will offer an intensive care unit. So for individuals in the community who have this really tough decision where, you know, their animal is in dire need of a life-saving surgery, but they know that the financial cost may be a burden, and they're already thinking about the horrible decision of humane euthanasia or not, they can come access our services, and our medical team, with the help of the designated ICU space, will be a real value to the community. In short, this makes sure that folks are united and stay united with their pets, because we really believe that pet unification should never come at the cost of dollars and cents. We really think that if a person finds a companion and is providing a loving, stable home, we want to keep those two united as long as possible. And financial, a financial toll should not be the decision maker to separate or not.
Absolutely, absolutely. That's really important. Now, one of the fun part of the facility is the play yards. I think in the video loop that our audience can actually see, there are two main ones, I think internal ones, right? So that, but there's also another one that's right outside of the facility, but the ones in the kind of like the courtyard. So that was kind of like really nice. I don't know who designed it, but it was an excellent idea. So if you can actually just elaborate that a little bit.
Yeah, absolutely. So our Chief Executive Officer, Adam Lamb, really has been instrumental in the overall look, feel, and vibes of the entire facility. And one thing that was really important to him when working with the architectural team, and you're actually seeing it on your screen now, is the courtyard that houses two small play spaces. So this designated space is actually inside our shelter. So it's interesting because an individual will walk into the shelter and they can walk outside into the courtyard for a meet and greet with their prospective, pup. And that is unique in that we're creating a designated space in a controlled environment that will allow for a proper meet and greet. So perhaps you have an own pet and you want to make sure that Fido, who's your dog for 7 years at home, mixes with Fifi, who is at our shelter. Well, that space will be utilized for just that. We're excited because it is hyper, it's just beautiful. I mean, it's hyper aesthetically pleasing. And then we also, as you said, Kemal, we have a number of outdoor play yards. We have one very large outdoor play yard that our behavior team, our operations staff will conduct daily enrichment sessions with our population. So we're really, really pleased at the amount of outdoor space, but also the functional space that we have that help ensure our animals will be receiving the enrichment that they need, specifically in a shelter environment, because we all know that a shelter environment is not always the greatest environment for these lives.
Well, I think maybe that's one of the points that I was trying to make earlier. So usually these types of places, facilities, they are not so welcoming. But even during the construction phase, what I have seen there is I can actually see this is almost like a 5-star facility. And I think between you and Adam, you guys did really amazing. So and we are just lucky that we are able to participate and then be part of what you guys are doing. Now, because we are big dog lovers and cat lovers always get upset when I don't talk about cats. So we do have a cat room, and I forgot the term that you use. There is a patio, right, for the cat?
Yeah.
So tell us about that a little bit.
Yeah, you're absolutely right. And I mean, Kemal, you and I are so similar that we would talk about dogs all day and forget our feline lovers. And I apologize, but this space is going to be unique in that we actually have a catio, and it's thinking outdoor patio. Well, this is for cats. It's an indoor outdoor community setting for our shelter cats. So these cats that will live in this community setting are adoptable, but they also have the discretion to be either inside the facility or outside of the facility in this enclosed area. The photo you actually have on your screen now is the catio, but it's at the time was not yet complete. So it's going to be a really great space that is spent, front and center, frankly, because it's right by the main doors for the shelter. So folks can walk in and instantly see some of the cute cats and kittens that we'll have for adoption. Again, it really invites folks into the facility, and that ultimately means that we're going to be more successful at placing animals in their forever home.
Oh, that's really nice. And I do love cats, but I do have allergies, and this is real. I'm not faking it. So the staffing, this is a big challenge even for other businesses, especially because of the pandemic that we went through and we are still going through. And many of your people are volunteers. So, but you also have people who are on staff, permanent, like full-timers or part-timers. How do you handle that? Number one. Number two is, with this expansion, how is that going to change? And are you able to find people? And do you have enough volunteers? What United Medical can do with our team that maybe we are able to help more?
Yeah, I appreciate that opportunity because we are always in need of more volunteers. And we try to make it as easy as possible. So if you go to bvspca.org, you can click on a drop-down tab that is a call to action to get involved. And right there, you'll see a secondary hyperlink that is volunteer. You fill out that form and sign up for an online or in-person orientation. Our community engagement team will ensure that you're trained up and feel comfortable for some of the roles that we have in our shelter. That's not to say that, if you've got a specific talent, such as photography or videography, if you're an administrative extraordinaire, you can actually indicate that on the application and we'll align you with the things that we have going on in the Newcastle shelter or across our entire market. In 2021, we saw over 73 volunteer hours across all 4 of our campuses. In Newcastle specifically, we saw over 10,500 hours dedicated by our volunteers. Mm-hmm. So they really are the backbone of the organization. They're the ones who ensure that we're able to do our critical work every single day. This project, though, will also require additional full-time employees, specifically with experience and degrees in the animal health and veterinarian science field. So with our doubled capacity of our wellness center, we're going to be hiring at least 2 new veterinarians. We'll be also sourcing new vet techs and some of our other clinical staff. We'll also, of course, be hiring additional sheltering staff, which is great because this really is a true economic development opportunity for folks who live in the local community. Not only were we able to put $7.5 million in a brick and mortar facility in roughly 16 months, but we're also looking for local employment. And we're really, really excited that we're going to be able to extend our workforce through full-time employment, but also additional calls to action and support through volunteerism.
So I think one of the key factors for the volunteers is it's not something that you just show up and then you are able to help, right? So you really need to be trained properly in order for that person to be helpful. And I think that part is always being missed. So we do need some commitment, initial commitment, so that they can be trained. So not everyone is okay to volunteer if they are not willing to go through that training. And I know we provide that training for those who may be part of the organization from that point. So I think that's kind of like important. Now, the other thing is, I didn't include in the videos, but I do want to mention, we do bring a lot of other animals from those states where there may be hurricane or other natural disasters. And I know we are able to help those as well. Can you talk about that a little bit?
Yeah, absolutely. So our Second Chance program really is a program that's developed out of a strategic partnership with a local parish in Louisiana. The parish is called Tangihoa Parish, and it's in a rural setting about an hour from Baton Rouge. And through a strategic collaboration with our friends at Best Friends, which is a national organization, we've been able to embed staff down in that parish for about 16 months. And during that 16-month process, we were able to take the local shelter's live release rate of 23% all the way up to 90%. So we're down there making an impact, providing technical assistance, providing best practices, ultimately showing them how we do the work every single day. And part of that work is that on a bi-weekly basis, we're actually transporting lives from the South here for second chances. These are animals that would have otherwise been euthanized based on overcrowding and overpopulation. So I'm sure folks have seen in the media or on our social media platforms that a flight's touching down in Georgetown or a flight's touching down in Newcastle, and we're welcoming 100 new lives. That's our Second Chance program. And it is fundamental to our mission and fundamental to the work in which we're really tasked to do. And I kid you not, there's nothing more moving than being on that tarmac and, opening the plane's, door and hearing these, barks of joy almost, and being able to mobilize our team to get those animals off the plane and back to our shelter safely, that then we'll find forever homes. And it is truly important work.
Well, that's really amazing. So, many of the people do have a really good understanding, but there's still some who really don't really get the main issue. When the animals are a little bit different than people, when they need really help, they're not able to communicate. When they're in trouble, they're not able to communicate. They're not able to speak, and they're part of the society. And we do need to actually do our best, even if in different parts of the United States or wherever we are able to help. It was amazing that we are able to so efficiently do that, because I see the numbers being adopted on the same day, and then the foster families who are really helping. That's just extremely rewarding. So one of the other things that I think I shared this with you, finding ways when you are going through some difficult times, channeling the grief into something like Brandywine SPCA, or I work with other institutions as well. It's another way that I find out that that's helping me a lot. I shared earlier, and this was your contribution, you and Adam's contribution to me, and losing Buddy was extremely painful, and I don't want to keep him on too long because I want to keep the. Honestly, I didn't want to just cry. So, but the only thing that was helping me to kind of feel better is because of him, then I'm able to actually reach out to more animals and help them through your organization. That's actually I think I do recommend that to people who have the either financial means, or if they don't, they have the time, then they can actually maybe help through volunteer programs. This is really important. Now, what's also important is how much work it takes. And I don't know how you guys are doing it, but when we have these little pops, so it's right now this is Joshua. So it was a little after 3 months I got him. So I can tell you how exhausting going through this time with him. And I do have a couple of people who are helping me with this, and it's still so difficult. And your organization, Adam, and what you guys are doing with the facility that we have and running this in different parts of the state, different parts of the United States, it's just amazing. I think you'll definitely go to heaven before I go. So you are in good shape. So you don't have to worry about the other side. So Tanner, this was really good. Just wanted to ask you if we didn't mention maybe, but Tatiana Copeland is one of the really fine ladies that I know. I don't know her personally well, but I met her 5-6 times in different events, and I think she was the big help. She was the biggest help. And the only time I get a little envy is when others are able to donate more than I do. So, and the goal is to get to her level. She's an amazing lady, and we do appreciate her help. Anything you would like to add before we close?
I just want to say, Kemal, trust me, your support has been so meaningful over the past, year and a half plus, and I really look forward to working with you for a long time in the future. I know Adam does as well, and it takes a village, especially for the line of work that we are in. So every single person playing a part is just absolutely outstanding. But then it's always great to see folks who maybe have a shining star in that village, such as yourself, who rise to the occasion time and time again to support us for our efforts. There hasn't been a single time that I've asked for help for something and you've said, I can't do it. Every single time you've done it, and you've been super impactful to the organization. And I know that Adam and I both are deeply grateful for that. And thank you for helping spread our message and the work that we do, because without people like you, we would, we would have to continue to try to spread the work through a number of different ways that often, doesn't touch everyone. So I really appreciate your time today.
Well, thank you. Thank you so much, Tanner. Thank you for being part of this event, and we'll see you soon then.
Excellent. Thank you so much. Thanks for having me.
Thanks. All right, so I am letting Sean is in the same room with me, but this time I put it in the waiting room. So Donna is there. So let's see. Donna, are you on? You're on, but
I am.
Sorry, we kept you a little bit longer than I was expecting, but the conversation was good, so I didn't want to make it short. So Tanner is amazing, so they do a lot of good work. So hopefully we can reach out to more people. So Sean said that he's going to volunteer next time, right?
That was right. I want to get on the catio.
That's a cool name. Now, so since we don't have the Brandywine Friday, so we can actually cover our clinical discussion. Then we go to the global and the U.S. economy. We'll do that next week.
Yeah.
So now, so Donna and Sean and also Kim, every morning we are 8 a.m. So we are on a meeting, on a Zoom meeting. but we are not just meeting, but it's a case conference. And then we discussed the case conference in several different times. We explained what this is. One of the reasons sometimes I feel kind of a little bit guilty not coming to the office until after 11, because I have 2 case conferences, 8 a.m. and 10 a.m. And I do them from home office because we do have an office in Turkey, and we are all trying to help all together. So, but in case some of our employees are wondering where I am, so I'm actually doing a case conference, and they can always go to Roxana's office, and then they can just participate if they want. So, but we've been doing that for almost a little over a year now. So, one of our goals was to share some of the outcome and then make something meaningful, and having Kim and Sean and the team, they're able to help us with some of the follow-ups, and not other than what they do in the case conference, but there are certain things that needs to be followed up, like this case study, and what we are actually learning from these, and then we can actually share these with our providers, which we do every Thursday night. And we also talk about these in these events. And so just to kind of explain, and I don't know if the video is going to be easy to go through, but we'll try. I'm going to restart that video. That PowerPoint did not actually bring that. For whatever reason,
Yeah, it was around slide 15.
actually, no, I have it. I lied. So I'm going to share my screen to make it a little bit easier, and then we'll go back and forth. Maybe I did not pick any of the images. I'm not responsible for.
I know who did. I'm not going to say, but I know who did.
Okay. So now the idea is we want to kind of make this a little bit more simpler to share with everyone. So
I can start us off here. So again, not to recap everything that Kemal just said, but just to remind everyone that these case conferences kind of just pick out some patients that we see that are alerting us, and what we end up doing is diving in a little bit more in depth in these audits and reviewing their charts, histories, seeing what kind of referrals and consults and how we can actually help them out overall. So just a brief intro on this one we have here. I was a 31-year-old male patient. And we started this review actually back the end of 21. So it was about the end of December of 21 when we first got our attention, and we started diving into this patient and checking out his charts a little bit more in depth.
So because I'm sharing the screen, and then because you and I are in the same room, and then because we are using my camera,
It's only going to see.
PowerPoint takes my picture. So what I'm going to do is let's just because now they can probably follow the video loop. So I'm going to stop sharing for a second because the issue is our patient. We know who it is, like the profile of the patient, what they do, what difficulties they have. So let's now we have someone, because I've been talking about this with Dr. Erkan on Bariatric Fridays. Morbid obesity is one of the biggest origin of the many other diseases, not just by itself. So when it doesn't come by itself ever, so it's always flirting with these other diseases. And so this was, when I saw this patient, it was not in our bariatric case conference, it was in our ACO case conference. And I'm like, okay, this is what we are trying to talk to other people. But what was nice about this is that how we were able to actually help this patient, and because it takes 6-7 months to see the results. And I believe this patient now is going through the bariatric surgery.
Yes.
But before that, what's important, what makes it important is there was diabetes, right? So if you can actually talk about those comorbidities a little bit.
Yeah. So like Kemal was saying, obesity is one of those illnesses that does have a lot of comorbidities, and actually addressing the obesity itself can help reduce and heal some of these other illnesses such as diabetes, hypertension, and even depression, anxiety that people sometimes get when they face obesity. So the patient that we have here, we were alerted by having a high BMI. They had a high A1C, and then their hypertension, and also have depression, anxiety. And what the A1C is I believe it's the amount of fat in the blood on average for the past 3 months. And what that is, just for those who aren't familiar, maybe from a medical background. So you do not want that number to be high, you want it to be low. And for us here, anything over 9 is considered to be an uncontrolled level.
It's like dangerous. So anything between over 7 is bad, but 9 is another level that makes them extremely risky.
Okay. Yep. So this patient in particular, for seeing this weight is actually displayed on the screen right now. So they were having difficulty with their weight. Obviously, we see that their weight's over from 2018 until 2022. The lowest ever was 340 pounds. And you can see they kind of fluctuated in between that 340 to 390 range. So there were some times when it did go down, but overall, we know that there obviously could be at a much healthier level. And so what we want to do here in this case conference is see how we can help out this patient and get their health to the most optimum level that we can achieve.
So let's see. Now, one thing that was kind of interesting with this patient, the endo order and neuralgia order was actually given by the primary care.
Yes.
And patient forgot about it. This patient's A1C was 10 points.
10 points.
Right?
And it was 10.3, 10.6. But yes, the order was given back in October. And then when we got involved in December, they still were not.
The patient said that they completely forgot about it.
Right.
Well, this patient is about 60 to 70% more riskier than anyone else in terms of having a heart attack. So I always tell people, look, if this is your father, what would you do? If this is your sister, what would you do? If this is your mom, what would you do? If this is someone that you love, do you want that person to be at that risk? And the resolution actually is simple in many cases, because while we are working on the morbid obesity issue, we are also having other specialties who are actually part of the care, which clinical integration is the key. And from the multidiscipline approach that we have, so we are bringing all the other problems, we are putting all the other problems under control. So this becomes a really good kind of example of, okay, this is how easily can be achieved if we are able to work together. And I was actually really proud of the team that's making these impacts on these people's lives. So and then it's kind of nice when you see them in writing. So some of these are from the patient who are actually directly writing to us from our patient portal, because that's how we are communicating with our patients these days. So, and they're in writing, they said, well, I absolutely forgot about this, and thank you for reminding me. And then that little pressure or little hand-holding actually takes them to the next level. And this is what our care coordination team is able to do. And Donna is doing an amazing job to lead that team, and we are lucky to have her. So what else? Like, I think this graph I want to share. This is extremely powerful. Like we already said what it is, but seeing the actual graph would make a big difference. So this is the
Right, because if you look at that, Kemal, and you look back at 2018, right, it was almost 12.5. So it was between 12 and 12.5. So it never really changed, right, between the end of 2018 and then until early in 2022. we'd like to think because we got involved and started reminding the patient and putting the orders in and getting the patient to the right place. Again, with the case management, I think a lot of times patients like to know that someone else is out there looking out for their best interest, and trying to get them, to the right place. Again, reminding them, not just giving them something, we're all busy, they take it home, they put it away, and then clearly they forget until they receive a phone call that says, by the way, you got this, 3, 4, 5 months ago, and now we're able to quickly get them in to see our endocrinologist. They change their medications, and within just a few months, the drastic change in their A1C, which means the drastic improvement, right, in their health as well.
Absolutely. The other thing, Donna, I have to tell you. So, as I mentioned, there are 2 case conferences every day. Actually, there are 4 because in each we do 2 at the same time. So, with this patient, there is a different set of nurses who are doing work that ACO nurses, they're not working together, but then they are in the same system. So when we actually, I'm going to share this. So when we see this patient from the morbid obesity case conference standpoint, there was already another nurse who was assigned to this patient, and then they were helping with all the other appointments that they need. So, and that's from Kriya's team and American Surgery Center all together. So we were able to have 2 different, same discipline, but from 2 different approach. We were able to actually help this patient all together. So that's actually, then I felt a lot better with what we are doing, because this is not easy to achieve, because this is our first time doing this. We do it with United Medical in the last 6 years, but there is no such care coordination somewhere else prior to us. So this is all new stuff. Like when we started population health, the term population health was so alien to everyone, because they thought I made that up because I'm from a different country, so they think it was something that I made up. I'm like, no, this is the term that we have, right? So this is in 2009, 2010. And 6 years after that, we were live with the actual product. So this is really important. And we are going to share some of these patients that we are able to positively impact. And there are more to come, actually, since we are include them in our sessions. So it also kind of puts a little bit pressure for us to make it a little bit better when we are presenting. So I'm sure we are going to be able to do a better job in the next couple weeks. So Donna, anything else you would like to add?
I just wanted, and I don't know if you want to show the graph, but the one thing I did want to say though, with the A1C, I know there were 20 some patients, and I think that's just key to see as well, that with a number of patients, we were able to take a quick look back, and you'll see some of them did not go down, drastically. But I think it's just depicting that when we get involved and we help the patients get to the right provider, we help remind them about medication adherence. We help remind them about getting their blood work done. We have some offices that are doing some of these studies right in the office now, so it's more convenient for the patient. You can see here that out of this list, all but 5 are showing that they are decreasing in values. Some are, less significant than others, but at least they're moving in the right direction. And I think that's really what we wanted to point out, is that, we are making a positive impact here with helping patients to get back on the right track and get better results.
Yeah, that's really actually important, because one of the reasons I didn't want to actually just bring this up, there were a couple of ways to, I didn't know if they were able to see it, but then it's not the video, so it's on PowerPoint, so they can actually see the whole thing. So part of the issue sometimes we have with what we do, if it's not measurable, like if it's not tangible, so we are not able to measure. like feelings is intangible. So like you feel good, you don't feel good. So I can measure that. But proper management of A1C diabetes is tangible, it's measurable. So measure is your A1C was 12, 6 months later, your A1C is 6.7. Now, how to get to that level is, it has a lot to do with working with different specialties. Now, we have one of the state-of-the-art and only private dietitian accredited diabetes center. And the reason I'm saying is because if you don't have the nutritionist on board with the patient, then you won't be able to see these results. If you don't have the specialist endocrinologist who's also on this team, you won't be able to see these results. So out of 29 patients, 24 of these patients, we were able to bring their numbers down, and now they are less riskier for any other issues that they may have, like heart attack is the biggest one. Each A1C point over 6, I believe, for each point, your risk goes up by 10%. So if someone is at 12, A1C at 12, they are 60%, just from the A1C, they are 60% more riskier to have a heart attack. Then on top of that, this patient's BMI was extremely high. So it's the perfect disaster. So you have all the ingredients to just die unexpectedly. So what we are trying to do is help those individuals, those patients who are part of our organization. So then hopefully we are able to save more people. So
and I think that's key, Kemal. You mentioned feeling, how I'm feeling, but remember, we talked about this with some of our specialists as well. The cardiologist being one, Dr. Hasmani, and also Dr. Hundle, our endocrinologist. You can't always go by how you're feeling, because when you have a high hemoglobin A1C, for example, for a long time, your body adjusts to that. So you may not feel any different or think you feel okay, but that doesn't mean that the high hemoglobin A1C is not affecting your body, correct? To your point where, and the high BMI, the high blood pressure, all of those things, that's why when things happen, stroke or heart attack, they happen very suddenly, because then, at a particular point, your body can no longer protect you from all of those things. So just something to keep in mind. You don't have to feel bad to have issues with your health.
That actually is absolutely correct. And the other thing is that when you have, what happens when the diabetes is not controlled long time is the anxiety, depression. Even though you may not be depressed, actually, it will start happening to those individuals, because if they live with diabetes too long and it's not controlled, the anxiety is always there. So these are all connected. So the easiest way to fix this is, well, number one, follow through with your primary care physician. Now, these individuals on this picture that you see, this is from our Bariatric Friday program, where these patients, some of these patients couldn't make it. They started with the bariatric process, and maybe half of them were done because there are a lot of reasons. But one of them is the commitment is not there, understanding of the disease is not there, and all these is easy to fix if we are able to understand what the origin of the problem is, and hopefully help those individuals in a better way. Right. Well, thank you for joining us. I know you have a lot going on there, so hopefully things are better. Sean, thank you.
Of course.
So we had a good session, and we'll be back next week. Dr. Erkan is going to be with me, and we'll finish up on Samantha and Katrina. And then we'll be able to start a new cycle on the Bariatric Friday. I have 3 new patients that I picked. Hopefully, we'll be able to see the process from a different perspective. And again, thank you so much for being with us.